Where are common places that we check all the pulses? Okay,
Radial,
Brachial,
brachial, we can check those, right? Where else are
Brachial.
palpable pulses?
popliteal,
Carotid, you can do that.
popliteal,
Femoral, right? You have to kind of be down there, right? To get
Yes.
it in there. Where's that?
behind your
Behind
knees,
the knee.
the tibial,
And usually you can assume if they have a dorsalis pedis or posterior tibial that their popliteal is probably.
yeah,
So that's why it's not commonly done, because you can get it downstream on it. And you know, if you have to just choose one of the two to check in the foot, what you're gonna check?
dorsalis pedis, the tibial.
the tibial,
Posterior tibial, right?
Tibial.
Because he says sometimes there's,
because sometimes the
You can't
dorsalis
feel the
pedis, you
dorsalis
can't
is
feel
not-
it.
That's true.
based on some,
Yeah, it's like harder to feel.
just
Unless
structure
it's like-
changes there. Okay, common vascular symptoms, we talked about this. Obviously the blood vessels, when we do HENT, we'll talk a little about lymphatic, right? But obviously they very much relate to amount of fluid, right? The lymphatic system is what recovers fluid from the tissue, right? And, you know, this is important when we get towards lymphatic and checking nodes and understanding the draining patterns. So we do find lymph nodes
Yeah, we put
that are
them
available, but they're all dumping into the venous system. So, edema, arms, legs, we talked about pulses, lymph nodes. No lymph nodes. So again, we should be checking, we talked about this, we should be checking patients in the supine position. So we don't tend to use percussion so much. It's a little challenging just with the rib cage anywhere, right? To be able to assess kind of because percussion, you have to be able to hear the sounds very clearly. You have to be able to distinguish, and it should be the organ you're measuring, right? So, and we will practice some percussion at some point when we do it a little bit more, maybe for lungs. So, jugular venous distension. So, right, this is typically just kind of an indirect measurement of venous pressure, right? Putting your head back 30 degrees. This is another one of those skills that you should have in mind on there. Head above 30 degrees. So your head turned a little bit. So let's see where that picture is, right? So we're using the angle literally right here. And we're measuring basically up to where the sternocleidomastoid, the muscle comes in, right? Nearly like the jaw on there. And you're measuring the size, 95 centimeters, come up with a rough estimation of pressure. So. They did a pretty cool one in that video too, where you, everybody take their hand. Say you were laying back, right? So you can do it the same way, kind of roughly estimate. So you lay it down, especially if you can see veins on your arm. Right, this is kind of the same kind of concept here, right? Can you see veins on your hands?
Yes.
So start to lift it up. You'll notice at some point they flatten out.
Oh yeah.
Are you hydrated?
Oh my god, it's so cool. It's true. I never knew that.
Mine are already flat.
What was that?
No, mine's bulging. Look.
Do you see them flatten out?
Mine are
Yeah.
already
So you
flat.
do the same thing, kind of a measurement, the same way they have a
My
video on that.
my
How to kind of do
bulging,
bedside ones
la
without
vena,
something a little less
no,
fancy
para abajo,
techniques.
para
And
abajo.
measuring when they
Lo
flatten
va
out.
subiendo.
Because they're gonna flatten out based
And
on
they're
the
gonna
amount of
flatten
pressure in the venous system.
You're gonna see them flattening.
Did you see
Super.
them?
You can get some.
Yeah.
Yeah.
They're like they pop.
That's cool.
Because he used
Carotid
to work out.
assessment on there, the same way. We saw an example in the video when the carotid, we could see the pulses from the carotid artery. It is possible on there.
Muscle memory.
And different ways, different rhythms to report, you know, different pulse rhythms, paradoxical can occur. They're kind of definitional. Okay, this is just a little bit how inspiration changes venous return. Obviously, when we inspire, we increase the volume in the venous system because right? As the lungs expand, it's compressing the blood vessels, pushing blood out. Right? And then we talked about how actually inspiration can change stroke volume, can change the way the valves close. Got mail. So heart disease, different classifications for this. This is a commonly used classification system. Okay, that's that. Kind of finished, right? How we feeling? How's the energy? So look. Okay, let's take a breath on that. Ooh, you made it. So I guess between this week and next week, we have 2 more PowerPoints to cover. There is the tremendously long EKG, one at 166 slides.
Hola, Jackie, muchas gracias.
Right?
We can just go over the cardiac profile today.
You want to do the card? Do you have energy for that?
There's 8 slides. It's 8 slides.
Or do you want to watch another video?
No, it's short.
Yeah, it's kind of short. I think that one's kind of simple. Yeah. Or you don't want cool videos or anything, or you're crying, you want to watch them at home? The thing is, you won't watch them at home. I know you're going to go to sleep or something.
Well, today, but we have a whole week to watch them.
You got a whole week. I mean, you have your whole life, or as long as they keep it up. Yeah. You want to listen to an aortic regurg? I think did we do that one with that guy? This is different.
No, that's the
Same one. But why does he break it out like that? He's on the different side of the guy.
Yeah. Maybe he has 2 recurrent.
It's 2. We did diastolic murmur sound.
Isn't that the one we did?
We're not gonna do cardiac profile?
We could do. It's very simple.
It's 8 slides.
It's just the,
Big slides.
it's
I
like
thought we were gonna bring it up just to the video
just
for a
like
minute, just to see, because you
troponin,
won't watch it much. I just wanted to kind of give you a little.
CKMB.
Is that okay, or is you guys hate to do that?
It's literally like stuff
I
from
think this is different.
patho. Look.
And it's normally found in
We'll do one more video with the aortic regurgitation. I think we did not do.
all.
No, this is different.
Time to go home.
My purpose of this video, by the end of it, is that you become an expert on the approach to air regurgitation. We're gonna go
Wasn't the
through
other one aortic regurgitation exactly? Why does
Yeah.
he spend twice as much doing it on this one?
Because if I turn it off at 7, then
That's his thing. I think he's just an expert on that.
I should have paused.